Hello everybody and welcome to the Tuesday edition of Video Clips. And I have a couple of announcements. First of all, this week, January 15th, Wellness 101 Intro to Plant-Based Nutrition, our 90-minute action-packed, get you started eating a plant-based diet. That is tomorrow, January 15th, 9 p.m. And on January 16th at 9 p.m., conversations with Chef Del featuring winners, soups, and stews. And of course, you get recipes with that. Also wanted to let you know, the beginning of the year comes kind of fast, and we had planned to do the advanced study last week, but what I've done is I've rearranged this a little bit to give you guys time to sign up. So here's the deal. February 4th and 25th at 9 p.m. we're going to do 2 sessions on Whole, Rethinking the Science of Nutrition. Part 1 is February 4th, Part 2 is February 25th. If you're a member, it's $20 per session. If you're a non-member, it's $30. But I will provide you with slides and all kinds of take-home materials. It's a live teleconference, and we're really going to take a hard look at reductionism and how it interferes with people getting good advice about healthcare and making good decisions for themselves. All right, so I have a couple topics to cover today, and the first one I want to talk about is attention deficit hyperactivity disorder, or ADHD. And I'll just start by saying every time the Diagnostic and Statistical Manual of Mental Disorders is updated, new psychiatric disorders are included, causing more and more people who are actually just responding to life in normal ways to become labeled as sick patients and to qualify for medication. The other thing that happens is the parameters for existing diseases are often broadened in terms of diagnosis, which results in lots more people being diagnosed. One of the most insidious manifestations of this disease-mongering strategy, which benefits doctors and drug companies and hurts the public, is the increasing number of children being diagnosed with attention deficit hyperactivity disorder. Finally, some doctors are starting to reconsider this strategy and acknowledge that we might be hurting more kids than we're helping. This issue has become really important since over the last few years, medication for prescriptions for kids with ADHD have gone up 200%, for adults and adolescents 400%. So a group of researchers reported in an article in the British Medical Journal that reduced thresholds for diagnosis, and I'll get to what those are in just a couple minutes here, lead to harmful side effects from drugs that shouldn't be prescribed, but also from the psychological effects of being labeled as having the condition. Additionally, the cost is amazing. It's $500 just for $500 million, I should say, annually, just for overdiagnosed prescribing in the United States alone. And this issue has, it's grown all over the world, not just here in the States. Furthermore, according to lead researcher Dr. Ray Thomas, there is limited evidence showing long-term benefits resulting from medication and significant evidence for short-term harmful side effects. In other words, we're really hurting more kids than we're helping by diagnosing them with ADHD and putting them on meds. Drug companies aggressively promote overdiagnosis, aided by direct-to-consumer advertising that encourages people to ask for drugs when they visit doctors. The ads encourage parents to look at behavior that's modifiable with better parenting and the right school environment as a disorder that requires treatment with drugs. And somehow, and this just befuddles me, the enormous list of side effects, which takes up most of the time of the ad if it's a TV ad, and most of the space in the print ad, is overlooked. The biggest issue remains, however, that the diagnosis of ADHD is so subjective. I mean, if it's coronary artery disease or diabetes, there are clear markers, but there are no clear markers for ADHD, just the observations of parents and teachers and the reports about behavior that are given to doctors. I've actually taken the assessments, some of them online, and I qualify for a diagnosis on some days of the week. DSM-5 has made it much easier for a child to qualify for a diagnosis. Instead of before, the criteria was clinically significant impairment in settings, the new statement is, quote, interfere with or introduce or reduce the quality of social, academic, or occupational functioning. In other words, any behavior outside of the norm, whatever that seems to mean to people, qualifies. Age of onset has changed. Previously, symptoms had to be displayed by age 7. Now they've expanded it to age 12. Now, I still contend that ADD and ADHD are largely made-up diseases, like most of the conditions listed in the DSM. I've never met yet a child or adult who should take medications. Not only are the drugs useless, they don't improve long-term outcomes, but they're harmful with lots of side effects and significant increase in the risk that particularly children will develop other mental and emotional disorders, particularly bipolar disorder, for which they will also be medicated. So, my bottom line is this, and it's an unpopular stance in some circles. If you have a child that is not behaving normally, whatever that means, don't reach for doctors or don't call doctors and reach for medications. Start to look at getting to the root cause. There are effective therapies for this. There are other ways to resolve the issue. And perhaps the child really isn't ADD, just needs to be disciplined more, etc. All right, I want to shift on to another topic now, which is why cancer research, particularly in the area of looking for nutrients that might have an effect on cancer, why research is often quite disappointing. And I'll just start by saying for most of my career, I have been critical of the natural or holistic healthcare community just as much as traditional practitioners. So I find myself in the unenviable position of having both sides dislike me quite a bit. And an unfortunate byproduct of that is I do get an awful lot of hate mail. So anyway, I've just learned to develop some thick skin and not respond to it. But one of my criticisms of particularly the naturopathic approach to health is the willingness to incorporate almost any new idea into patient practices regardless of how weak the evidence supporting it might be. This has led to the growth of entire industries growing up around the use of unproven supplements like vitamin D and omega-3 fatty acids. But there are hints that a few people are starting to see the light. And over the weekend, I read a report from an attendee who happened to be a naturopath who went to a recent conference for the Society for Integrative Oncology, which described a lecture delivered by Frank Maskins, director of the Chow Family Comprehensive Cancer Center. Now, Maskins is an interesting guy. He was involved in the studies showing that beta-carotene increased the risk of lung cancer in smokers, the study that showed that vitamin E and selenium increased the risk of prostate cancer instead of lowering it, and the study showing that higher blood levels of omega-3 fatty acids increased the risk of prostate cancer. The author of this article described Maskins' work as a, quote, steady track record of failed randomized controlled studies, or RCTs. Maskins' lecture at this conference, which was the subject of the article, attempted to address why clinical trials on cancer and various nutrients continue to show disappointing results. Maskins reviewed results from a 2013 report that compared meta-analyses of randomized controlled trials with the epidemiological data that these trials were designed to confirm. Now, let me explain what that means. Observations are sometimes interesting, but they don't prove cause and effect relationships. So the idea of doing a randomized controlled trial is to see if the observation that you made would actually be proven out in more specific research. So in 23 out of the 34 trials reviewed, the RTCs and meta-analyses pointed to similar conclusions, but the outcomes reached statistical significance in only 6. In the remaining 11 studies, the RCTs showed opposite outcomes from the epidemiological data. To summarize, according to Maskins, there is a poor correlation between what we think will work to prevent cancer and what actually does prevent cancer. Now, why does he think this is the case? And this is the most beautiful part of this whole talk that I watched or read the review of. He says, quote, "The biology of living systems is more complex than we had hoped, and rarely, if ever, will single agents prove to be silver bullets, but rather we will need to think in terms of multiple variables and complex intervention." What a beautiful statement. It could have been made by T. Colin Campbell or taken from his book Whole, Rethinking the Science of Nutrition. That's exactly the point that he's trying to make. The author's comments on this lecture were superb, acknowledging the tendency of naturopathic doctors to be too eager to translate interesting ideas into clinical practice and actually stating that naturopaths tend to confuse epidemiological data as evidence of a cause and effect relationship. I'm encouraged. You know, there are serious limitations and issues concerning efficacy and harm that need to be dealt with in all branches of medicine, mine, naturopathy included. Naturopaths should no longer point to traditional practitioners and accuse them of failure to innovate based on science. They're guilty of exactly the same behavior. And I really think it's time for all of us to fess up, change our ways, and move on. We say us, I mean the medical community in general. We're doing a lot of wrong-headed things to people in medicine. All branches needs to stop right now. This indicates that more people are starting to see the light. Okay, that's it for today. Have a wonderful day. I'll be back to you on Thursday, and as usual, pass this on to anybody who you think might enjoy watching it.